Pack 365. Myself Srija. So today you are going to learn about the general ICD-10 coding guidelines. So which are the basic rules and principles? What are they? So what every medical coder must follow when assigning ICD-10 diagnosis codes. So clearly you are going to learn in this session. So what are general ICD-10 coding guidelines? So these guidelines explain how to select and apply the diagnosis codes correctly in the medical records. So they ensure accuracy in disease reporting, consistency in medical documentation, and also they ensure the proper billing and insurance claim processing. So what are the main sections of ICD-10 guidelines? Conventions, general coding guidelines, and chapter specific guidelines. So coming to conventions, you have already learned in the previous sessions. Now you are going to learn about the general coding guidelines, and after that the chapter specific guidelines. So actually what is the purpose of these guidelines? To help the coders. How to help the coders? To understand the structure and meaning of codes, to apply the correct sequencing of the multiple codes, and also to follow the uniform national standards for medical coding. So coming to the point, how to locate a code in ICD-10 It's a step-by-step process. So first you have to start in the alphabetic index. So you have to look up the main term for the diagnosis or for the reason for visit. So this index gives you a suggested code. So after seeing in the alphabetical index, then you have to verify in the tabular list. So you should always check the tabular list to confirm the full and correct code. So this tabular list, it provides the code description, inclusion or exclusion notes. It is required certain characters if any applicable, and also the laterality. Laterality means whether it's a right side or left side or unspecified. So you have to use both parts of the ICD-10 Alphabetic index helps you to find the code, whereas tabular list, it confirms the code and adds the details. You can also find a dash at the end of the code in alphabetic index, which means the code is incomplete and it needs additional characters from the tabular list. So even if there is no dash, you still must check the tabular list to make sure no extra characters are required. So if you find S52.5 dash in the alphabetic index, so go to tabular list to complete it. It might become S52.501A, the fracture of lower end of right radius initial encounter. So this is the way how to locate a code in the ICD-10 So this is the first step. And coming to the second step, the level of detail in coding. So what does it mean? So always use the most specific code possible. So this ICD-10 codes can have 3 to 7 characters, right? So the more the characters, the more specific will be the diagnosis. So the breakdown of the codes, the 3 character codes or category codes. For example, Z45 is for asthma. So it's a general category. So this can be expanded by adding more characters for the details. Like 4th, 5th, 6th characters, they give more detail like type, cause or location. Whereas 7th character, it gives extra information such as the encounter type, nothing but either it's an initial encounter or subsequent encounter, or it might be a sequela. So what is the important rule in the level of detail? A 3 character code can be used only if there are no more specific codes under it. So if a code requires more characters and you leave them out, the code becomes invalid and it affects the accuracy. So for example, when you take S52 code, it's a fracture of forearm. So when coming to S52.5, it's a fracture of lower end of radius. So you can find the difference, right? What is the difference between the 3 character code and a 7 character code? So this is about the second step. And coming to the third step. Code or codes from A00.0 through U85. So what it does mean? These are the main ranges of ICD-10 codes. So they are used to record all the possible reasons for a patient's medical visit. So such as diagnosis, symptoms, conditions, problems, complaints, for the encounter or visit. For example, A002, B99. What does it indicate? The infectious and parasitic disease. So coming to C002, D49, it shows you the cancer, nothing but neoplasms, each chapter of the neoplasms. Whereas Z00 to Z99, these are the factors influencing the health status like routine checkups, etc. So the last one, U00 to U85, and these are the new diseases. So these are the special codes like COVID-19. So these ranges cover everything a provider can document in the medical record. So the next important is signs and symptoms. So what does it mean by signs and symptoms? If the exact diagnosis is not yet known, you can code the signs and symptoms instead. But these are the temporary. So these are the temporary until the provider confirms the final diagnosis. For example, patient has a chest pain, but the cause isn't confirmed yet. So you have to code the R07.9 code, which is for chest pain unspecified. So this is the important point you have to remember while coding the signs and symptoms. So chapter 18 of ICD-10-CM, they cover signs, symptoms and abnormal findings. So you have to use these codes only whenever there is no confirmed diagnosis. So only a specific diagnosis is confirmed. So replace the symptom code with the final diagnosis code. Next one is the conditions that are an integral part of a disease process. So some signs and symptoms they naturally occur with the certain diseases. So they are the part of the disease itself. But these should be coded separately unless the ICD-10 book specifically says to. You are getting right. So whenever the symptoms occur naturally, they are the part of disease itself. So they should not be coded separately. When the ICD-10 book specifically says to code separately, you have to code. Until and unless you do not be coded separately. For example, cough with pneumonia. So don't code the cough separately because it's a part of pneumonia. So it's a symptom related to pneumonia, right? So whenever you code fever with flu, so don't code the fever separately because fever is a part of the flu. So this is the fifth step, and sixth step is only a small major, it's a not major difference, it's a small difference. Fifth one is which is an integral part, and sixth one is it's not an integral part. So whenever if a symptom or condition is not usually a part of the main disease, so you should code it separately. So for example, if a patient has pneumonia and also has vomiting, so code both because vomiting is not a part of pneumonia. Okay. So coming to diabetes with headache, so you have to code both because headache is separate disease and diabetes is a separate. So headache is not a part of the diabetes. So you have to code both. So this gives the meaning of conditions that are not an integral part of the disease process. So when coming to multiple coding for a single condition, so what does it mean? Sometimes one condition needs more than one code to fully describe it. So when does it happen? When there is a cause and effect. So this condition affects the multiple body systems. So you have to look for use additional code or code first. Notes in the tabular list. So this guide you to use more than one code. For example, diabetic retinopathy. In diabetic retinopathy case, you have to first code the diabetes, which is E11.3 category. Then you have to code the eye complication, that is retinopathy, H36.0. So this is the rules for coding the multiple codes for a single condition. So what is the sequencing rule for use additional code and code first notes? Sometimes two codes are needed to fully describe a disease. One for main disease and another for the cause or specific organism, as I had said you. So this follows the same logic as the etiology and manifestation. So one code shows the cause, another it shows the effect. So for example, when we take a patient has a bacterial infection, so this bacterial infection is not listed in chapter 1. So you may need to add another code to show which bacteria caused it. So what is the main condition? It's a pneumonia. So what is the additional code? It is streptococcus. So this streptococcus is a bacteria. It's a type of organism which cause the pneumonia. So you have to code the both. So use additional code note. So this note is found with infectious disease codes. So it means another code to show the organism always. So whenever a specific infection is caused by an organism, this organism is always coded by another code to state that so and so disease is caused by so and so organism. So code first note. What is meant by code first note? It is found under the manifestation codes. Manifestation is nothing but effect of a disease. So it means code the underlying cause first, then the condition. So you have to just remember this point. Always code the underlying cause, that is effect of the cause, or the manifestation code. You have to code the first. Then only you have to code the condition. For example, when you take the diabetic retinopathy, code diabetes first because it's a manifestation code, right? Then retinopathy because it's an eye complication affected by the diabetes. So you have to assign two codes, E11.3 and H36.0. So this is about the use additional code and code first note. So code is applicable any casual condition first. So what does this note mean? This note tells you to code the cause if known. So before coding the condition that results from it. So if the cause is unknown or not applicable, then you can use the condition code by itself. So whenever you know the cause, just code it before the condition is resulting from it. So whenever the cause is unknown, then you have to use the condition code by itself. There is no need of coding the cause again. So for example, if a patient has anemia due to chronic kidney disease, CKD. So what you have to code first? First you have to code the cause. So what is cause over here? Anemia due to chronic kidney disease, CKD. Chronic kidney disease is the cause. So this CKD, it affects the anemia. So then this is the effect. So anemia must be coded secondary. So if the cause is unknown, here the cause is CKD. But when the cause is unknown, you have to just code the anemia. But here the cause is known and the effect is known clearly. So you have to code the both. Cause followed by the effect. So multiple codes. How do you code the multiple codes? So some conditions need more than one code to describe them completely. For example, sequela codes. Sequela codes are nothing but after effect of an earlier disease or injury. And also the complication codes. For example, surgical complications. And also the obstetric codes. Obstetric codes nothing but the pregnancy related conditions. So you have to always check the specific ICD-10 guidelines for these conditions. So this is about the multiple codes note. So coming to acute and chronic condition. So if a condition is both acute and chronic, acute means short term condition, chronic means long term condition, and these are both are listed separately in the alphabetic index. So you have to code both. When acute and chronic condition both are present in the record, you have to code both. But always you have to list the acute condition first, followed by the chronic condition. So for example, a patient has acute and chronic tonsillitis. So what you have to code first? You have to give a code for acute tonsillitis first, then followed by the chronic tonsillitis first. Always acute is only coded the first. So this is about the acute and chronic condition note. So coming to combination code. So what do you mean by combination code? Which represents two diagnoses, right? A combination code is a single ICD-10 code that represents two diagnoses, or a diagnosis with a secondary process, or a diagnosis with a complication. So instead of using two or more separate codes, so one combination code, it covers the whole condition. For example, when type 2 diabetes mellitus is diagnosed with diabetic nephropathy. So what you have to code, there is a combination code for this. So this one code, it represents both the diabetes and the kidney complication as well. So E11.21 code must be assigned. So how to identify the combination codes? So you can find them in the alphabetic index under subterms. So always verifying the tabular list, checking the inclusion and exclusion notes for the accuracy. So what will be the coding rules for combination code? So use only the combination code whenever it completely describes a patient condition. So whenever the alphabetic index or guidelines say to use it. So do not use multiple codes if a single combination code already includes all the necessary information. If in case the single combination code is not present to include all the diseases given in the record, then you can use multiple codes. But if already a combination code includes, you have to code only the combination code. You should not code the multiple codes. So you have to use an additional code also whenever the combination code doesn't give full details about the complication. Okay. This is about the combination code convention. So next, coming to sequela. Sequela is nothing but the late effect. So it's a residual effect. Residual means left over, right? So this sequela, it always remains after the acute phase of an illness or injury is over. So it's a long-term or permanent consequence of a previous disease or injury. There is no time limit for the sequela. A sequela can appear soon, or a sequela can appear after a few months. It can also appear a few years later. So there is no time limit for this sequela. So what are the examples of sequela? It might be a scar after a burn, a deviated nasal septum after a nasal fracture, and also it may be the infertility issue due to the tubal damage from the old tuberculosis. So what is the coding rule for the sequela? Usually two codes are needed. Right. First one is the current condition or effect, and the second code is for the sequela code. So for example, scar from a old burn. So scar condition is the previous condition, right? So sequel of burn is the second code. So you have to both code the scar condition and also the sequel of the burn. So you have to remember, sequela means it's a late effect or consequence of a past injury. So there is no time limit for coding sequela. So you have to always code the effect first, then the cause. So this is about the sequela convention. So next, coming to the impending or threatened condition. So what do you mean by impending or threatened condition? So what does it mean? These terms are used whenever a condition is about to happen, right? Impending means about to happen. Threatened means expected to happen. This is a major difference between these two words. So what are the coding guidelines when coming to impending or threatened condition? If the condition is actually occurred, so you have to code it as a confirmed disease or confirmed diagnosis. So if the condition did not occur, you have to check the alphabetic index to see if there is a subterm for impending or threatened. So you have to always look the main term for impending or threatened. So if a specific subterm code is listed, so what you have to do? You have to assign the given code. If no subterms exist, you have to code only the underlying condition, but not the impending or threatened description. So you should never code the impending or threatened condition unless and until the underlying condition is not present. So you have to always check the impending or threatening condition actually occurred, and if ICD-10 provides a specific code for it. For example, there is an impending myocardial infarction, means it is confirmed as MI. Threatened miscarriage, it is not occurred yet. You have to code the threatened abortion. If, for example, impending appendicitis, it didn't happen, no symptom, you have to code the underlying condition like abdominal pain, etc. So this is about the impending or threatened condition. And next, coming to the reporting same diagnosis code more than once. So each unique ICD-10-CM diagnosis code, it can be reported only once per patient visit. So this rule applies even if the same condition affects both sides, like both eyes or both arms, unless there are different codes that specify each code. For example, if there is a one code for otitis media, otitis media means it's a ear infection and it does not specify left or right. So you have to report it only once, even both the ears are affected. So this is about the reporting same diagnosis code more than once. You have to never code a diagnosis code repeatedly. You just have to code only once per patient visit. So next, coming to laterality. So what do you mean by laterality? So laterality means which side of the body a condition affects, whether it is a right side or a left side or a bilateral, that is both sides. So what are the rules of coding laterality? So if ICD-10 provides a specific codes for left, right or bilateral, so you have to use them correctly. If no bilateral code exists, you have to assign two codes, one for left side and one for the right side. If the side is not mentioned in the medical record, so you have to use code for the unspecified side. For example, cataract right eye is given in the record. You have to code for the right side. When it is given for the left eye, you have to code for the left side. When it has given for both eyes, you have to code for the bilateral code. If there is a code available for the bilateral, you can code it. But if when it is not available, you have to give codes for the both sides separately. So if a bilateral condition is treated at different times, use the bilateral code each time since the condition still exists on the both sides. So when only one side still has the condition. So if one side was already treated and the condition no longer exists, so what you have to code there? You have to use the unilateral code for the side that still has the condition. For example, when cataract surgery is done on the right eye, now the left eye still needs surgery. So you have to code only for the left eye. There is no need of you for coding the right eye, right? Because it has already done. Now the left eye needs the surgery but not the right eye. So when you should not use this bilateral code. So you should not use a bilateral code if one side is already treated and cured. But if the treatment of the first side didn't fully resolve the condition, you can still use the bilateral code because the condition exists on both sides. It didn't fully resolve, right? In that cases, you have to code the bilateral code. So if laterality is not documented, so what you should code? If the provider didn't mention which side, either right or left, so you can use the information from other clinicians' records in the patient's file to assign the correct side. So this is about the laterality. So if a medical record gives different or unclear information about which side right or left is affected, so the provider must be asked for the clarification. So what steps you have to follow over here? If there is a confusion in the documentation, for example, one note says right, another says left. So what you have to do? You have to ask the provider to confirm which side is correct. So you should not assume or guess the affected side. So unspecified side codes should be used only when the documentation does not clearly identify the side and it is not possible to get the clarification from the provider. So whenever you get the doubt, you have the confusion, you always confirm the correct side with the provider. You should use the unspecified side codes only as the last resort when clarification cannot be obtained. So this is about the laterality. Yeah, that's it for today's session. In the next session, you will be learning about some more general ICD coding guidelines. Thank you.